The incidence of coronary artery disease, or the mnemonic as CAD, coronary artery disease incidence is on the rise in India and globally as well. We are seeing that in past few months to years, the cases of coronary artery disease that are coming to us in our practice are coming at a younger age, at an earlier age too. You must have been hearing that hale and hearty young people are just dropping dead on the streets. What could be the reason? I would say that the reasons here are multifactorial, and we need to understand why such a case or a scenario is happening. Now, we know that smoking is a very important risk factor for the development of coronary artery disease or the blockages in the arteries in the heart. So the incidence of smoking is on the rise amongst the youth. Another important reason could be the prevalence and incidence of corona. The coronavirus, they say, causes a thickening in the blood. The blood becomes thicker than usual, and it has a propensity to get clotted in the small arteries of the heart, which could also lead to a heart attack. Another reason could be the increasing stress in the life of today's youth. The competitive nature, the type A personality causes a lot of stress amongst youth. Because of this, the adrenaline levels in the body are constantly up, and they can cause a constriction or a smaller lumen of the arteries of the heart, which ultimately can result into a coronary artery disease attack, which is also known as a myocardial infarction or heart attack in general terms. So what do we need to do to prevent or treat this rising incidence of coronary artery disease? First and foremost is some lifestyle changes are mandatory to reduce the incidence of coronary artery disease in us. These lifestyle changes include both changes in dietary pattern and changes in activity level. We need to reduce the diets which are high in calories, like very high fat diet, very high carb diet. Smoking cessation is very important. We should not encourage smoking in any way. Those who are chronic smokers, we should discourage them from smoking when they are with us and around us. Simultaneously, the activity or exercise levels need to increase. This goes a long way in preventing the development of coronary artery disease at a younger age. Recognizing the symptoms of a coronary artery disease is also very important. These symptoms could be sudden pain in the chest or pressure in the chest, which radiates up in the neck or jaw or onto the arms, be it left or right. Shortness of breath is also a symptom of coronary artery disease. Sudden break in sweat, cold sweat without any exercise or activity is another important symptom. So if any such symptom occurs, we should immediately consult our physician or cardiologist, whosoever is available, and should not delay the consultation thinking that this might be some gastric acidity or heartburn.